Welcome, 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 ladies, gentlewomen, and the occasional gentlemen. I mean, you're welcome here too. To the Swan Report. I'm your host, Elena Banks, founder and national president of Kappa Theta Epsilon Sorority Incorporated, and I am very excited about the episode that we have coming up for you this evening. We are talking about lesbian health and wellness with some incredible women in the nursing field that I'll be introducing in just a second. Wave at the camera, y'all. I'm super excited to have this conversation with them. And I want to thank both of these ladies for being here with me tonight and sharing some incredible information with our audience. I'd like to start off by introducing my soror, my chapter sister, Soror Kearston Smith. Of Kappa Epsilon chapter. She is an RN/BSN and has 7 years of experience in nephrology. Hey there, Zora.
Hey.
Thank you so much for being with us tonight. And before we get started, would you explain to the layperson what nephrology is?
Kidneys.
That's okay. Okay, cool. So like yes. Dialysis and health, kidney health.
Kidney health, yes.
Okay, awesome. Thank you for sharing that. And in addition, we have a friend of ours, Miss Margena Staten-Branch, who is an adult nurse practitioner and has 11 years of experience in adult and geriatric care. Hi there.
Hey, thanks for having me.
Oh, it's a pleasure to have you join us tonight. I'm so excited about this conversation because as my soror Kearston knows, our chapter is spearheading holistic health and wellness this year and our programming around that. And we've talked a lot about wanting to inform the community about concerns that have to do with Black lesbian women and some of the challenges that they face in healthcare and receiving adequate care. So I've been looking forward to this episode and am so grateful that you guys could join me tonight. Tell me a little bit about your individual backgrounds and what inspired you to get into the healthcare field.
Okay, well, I've always wanted to be like a baby doctor since I was little. And I decided that I just wanted to be a nurse instead of a doctor. It's been a dream of mine since I was about 7. So I'm a caretaker. I take care of people when they're sick. I love doing it. I love feeling needed. So I felt like nursing was a natural thing for me. And I got into nephrology because of someone that I was dating who had issues with their kidneys. And I just wanted to learn as much as I possibly can to be able to help them, give them, knowledge to stay healthy. And it just kind of blossomed from there.
Awesome. What an amazing story to have that inspiration and desire as a child and to go on to fulfill that. And then to have someone in your life show up that kind of guided you into your particular specialty and your calling. So that's awesome. Thank you for sharing, Sora. I don't think I've heard all of that story in detail before. So thank you for sharing. What about you, Gina? What inspired your journey?
For me, my mom was a nurse. So growing up, I was always, watching her, playing with the stethoscope, just wanting to be with the dolls, wanting to be the doctor. So I think I'm a nurturer naturally. So just growing up, once I got out of high school, I already knew. I said, well, I did kind of fight it for a little while. I was like, no, I don't want to follow my mom's footsteps. But it just came so easy. I first became a medical assistant before I jumped into nursing to see if I really liked it, like being in the medical field. I became a nursing assistant, then a medical assistant. Then I went ahead and went to nursing school. So I knew that's where I wanted to be, but I wasn't quite satisfied. I wanted to be more of the provider, more the one who was actually taking care of the patients. And that one-on-one care is very important. So that's why I really went into adult health, geriatric health, to be that they need someone to listen to them, especially our geriatric patients. So I love being that person they can come to, they can have someone listen to. So it's that one-on-one care, being that person for them, that nurturer, that provider. That's what I was driven to be.
Awesome. Awesome. And it's so interesting to me to hear both of you talk about, like, you were inspired as children, like there was something that called you to this field. And, for Gina, like she saw her mom in the field and she was like, well, girl, I don't know. Like, I'm not sure I want to do that. But you still felt called to it enough to explore it and then go out there and fulfill that dream. That's amazing. So awesome. And thank you both for the work that you do in, well, I guess kind of tangential fields, not necessarily the same thing. So for you, do you see that most of your patients are seniors or leaning toward geriatric patients, or is it across the board, all ages?
I have patients of different ages. The youngest I've had is probably mid-20s, but most of my patients are older, 60s, 70s, some in their 90s.
Wow. Okay. Okay. And so for both of you ladies, I really wanted to ask you, have you seen any challenges that are particular to Black women first, and any that are particular to Black lesbian women that come up in your particular fields of care? Or what are you seeing that Black women have as far as challenges when, like, speaking to their healthcare providers and getting care?
I noticed, being a provider, because the population I'm with now is 65 plus, but it's Medicare Advantage. So occasionally we get some younger people in that are on Medicare for whatever reason. But the Black females, you'll notice, or I have noticed, that they're a little more hesitant. They're a little more, they don't trust very easily. So you have to build a rapport. So it's building a connection to get them to open up, because they're not forthright until they trust you. So it's building that rapport and getting them to trust to even get them to follow like a medication regimen or whatever you're trying to teach them to do. They just need to trust you.
Awesome. Awesome. And what about you, Sora? Anything that sticks out for you?
I definitely agree. A lot of my patients that are Black women, when they don't understand something the doctor is telling them, they don't ask questions. A lot of times they'll come to me and say the doctor said X, Y, and Z. I don't know what he said. I don't know what that means. But they don't feel comfortable in that moment saying, hey, I don't understand.
Right.
Or they don't feel heard. They feel like the doctor's not even listening to them. It's a quick in and out.
Mm-hmm.
And so, just taking the time to sit with them and actually explain things to them makes them feel a lot better. And building that rapport and having them trust you is really important.
Because I've noticed, like when I have new patients come in, a lot of times they don't even know why they're taking certain medications. They just go along with what the doctor told them. The doctor doesn't have time to answer questions. They push meds to them. They don't know that they're hypertensive or have high blood pressure or that they're diabetic. They just know they're taking these medicines. They don't even know what it's for. So I see that a lot.
Yeah.
Wow. And I think you both touched on something that I have seen a lot mentioned in the news and things like that about the time and room with patients. As far as patients feeling as though they don't have the opportunity to really speak with their doctor to get a thorough understanding of things. So I think it's really powerful that you're sharing that. That's something that you're seeing in your practice, right? Working with patients. Something that came up has come up in a lot of conversations that I've had with lesbian members of the healthcare community and just members of the healthcare community in general, is white coat syndrome, which has historically affected Black people because they had fear of going to doctors for valid reasons, right? We've got the Tuskegee experiment, tons of other experiences that Black people have historically had with healthcare professionals over the course of our time in America. Have you seen that white coat syndrome tends to be more prevalent amongst Black people? And if so, how can we overcome it? Is it seeing more people of color in healthcare that would help us, or what do you think?
I think that's part of it. Seeing more people of color, treating them. They go into doctor's offices, and a white doctor or a white nurse practitioner, they don't understand or connect or communicate the same way. So they kind of hold things in. And then, of course, their blood pressure is going to be high because they're anxious about the visit anyway. And it just starts out on the wrong foot because they're going in not trusting.
Interesting. Sir, did you have anything you wanted to add or any other thoughts about that?
I honestly feel like I can't really speak on that too much because most of my patients have high blood pressure anyway.
Mm-hmm.
So, so I don't know. It's not really a cause of them, from them being anxious. It's just because of, their kidneys in general. But
Right.
I do know that sometimes even when I go to the doctors,
Mm-hmm.
I get my pressure's a little bit higher than normal for me, because I have so many things that I want to talk about, and I know that I'm not going to have the time to get everything situated. I'm kind of going to get pushed out the door, and it makes me nervous to know that I'm going to leave the doctor's office without having all of my needs addressed.
Right. Because they can only address so many in the little time.
Right.
You're in there for 5 minutes, which is nice about where I work. With our seniors, we get 45 minutes to an hour. So we have that time to listen, and we don't give them, you can't come in with 7, 10 things to talk about, but we do ask them to put the priority up top, and then we'll reschedule you and bring you back in. But we find if you check the blood pressure at the beginning and it's high because they're nervous, we recheck it at the end, and hopefully they've calmed down and relaxed more because they were able to talk and get off their chest or have their concerns met.
Awesome. How do you feel like language plays into like having some of the conversations that you have with your patients? African American Vernacular English, also known as AAVE, is really prevalent across socioeconomic strata in our community, right? So like, I'll use my family, for example, right? A lot of people wouldn't say like, hey, Aunt Hattie has diabetes. They would say like, oh, well, Aunt Hattie's sugar is acting up or something like that, right? So like, how important is it for healthcare providers to have at least some exposure to AAVE in like cultural dialects when it comes to dealing with patients and giving them care?
Kearston, you want to touch on that or?
For me, I use the same type of language with everybody. I just use very simple terms. If, I'm talking to my patient and I'm asking them about their nephrologist, I just say, have you seen your kidney doctor? Because it makes it easier for them to understand, what doctor does what when you use it like that. But that's just how I speak to all my patients, whatever age, color, anything.
Okay.
Yeah, I've noticed, like even our paperwork that we give has to be like to a 3rd or 5th grade level so everyone can understand it. But I kind of adjust mine to the patient. Some people are very educated. They don't need you to they feel like you're talking down to them. So it just depends on the patient and what level of education or, socioeconomic status or whatever. Sometimes it's their background. I'll have a Black patient come in and we talk like we're talking now and or a white patient come in, and I had a white patient come in and she said, I'm Black too. So she was talking more ethnic than I was. So it just depends on the patient for me. I can adjust and it's just finding that happy medium for them where they're comfortable.
It's good to know that like providers, especially providers of color, African American women providers, are receptive to meeting a patient where they are when it comes to having conversations with them. But just from your own experience as being part of the community, have you seen any challenges with LGBTQ patients, and how can they feel more comfortable speaking with providers or even disclosing that they are lesbian or gay?
For me, like when I did a specialty in sleep medicine, so I would see all ages, male and female. And then where I am now, I still see, even though I'm with older adults, I still occasionally will see, some 50s, and they are in the LGBT community. And I'll notice they'll come, when they first come in, they're a little kind of standoffish, kind of guarded. Some don't want to be kind of forthright with their social information, but it'll come out as we're talking. And then I've noticed if I let them know in some slight kind of way that I'm in the community as well, they relax and they're able to talk more open. But yeah, with other providers, the provider's not comfortable, the patient's not comfortable, and a lot of things get missed or misinterpreted, and they lack care. So yeah, I'm seeing it on that side too.
Okay. Interesting.
Because they don't want to open up. They feel judged. I have been in a doctor's appointment at my OBGYN and not wanted to disclose so many things because I didn't know how the provider was how they would accept it or take it.
Yeah, I've had a similar experience where it was almost as though the doctor was shocked when the question, the inevitable questions come up. Well, are you active? Are you, could you be pregnant? All those sorts of things. Mm-hmm. And, even if you have if you make a cryptic comment about, I'm probably not pregnant,
right.
And then they ask, well, how do you know? And things of that nature. Yeah. You can sometimes see the realization
right.
and the discomfort that comes with that. So, definitely.
So it's important for the providers to be comfortable with having those discussions too.
Absolutely. Absolutely. Sor, did you have anything that you wanted to add on that?
Just from my personal experience, I seek out medical providers or clinics that are specifically geared towards the LGBTQ community, just because it makes me feel a lot more comfortable knowing that a lot of my care is not centered around being heterosexual. That they're inclusive of everybody. It's kind of like a general thing. And then they tailor it specifically to your situation, but it's not, oh, your husband, or are you married? What's his name? And I'm like, who's he? No, there's no he. But, stuff like that. But I think there are not enough clinics or providers that we know of that are very inclusive, that it's kind of, I don't want to say advertised, but kind of advertised, where this is a clinic that's geared towards the community. Mm-hmm. You kind of have to do a lot of digging.
Yeah, you do.
To find providers that are inclusive, or centered around, the community.
And it'll be real small at the bottom of the website or something.
Yeah.
Yeah, and I guess that for some clinics is a business move as well, right? Because some potential patients may not even visit a particular provider because they know that they assist LGBTQ patients as well, or are inclusive of LGBTQ patients, which is sad, but it's the way of the world. Some people are just that way. So just from your own experiences, ladies, what are some key conversations that you feel like, since you are in the healthcare field, that lesbian women, whether they be feminine, masculine presenting, non-binary, whatever, that we should be having with providers? Just even beyond OBGYN, what are some things that we should be talking to our doctors about that often go unnoticed?
Anxiety and depression.
Mm-hmm. Yes.
Some people are struggling with identity. Some people are just struggling with the whole sexuality thing, and they're dealing with it with either their coping mechanism is alcohol or whatever, just not addressing the mental state, the mental side of it, the mental health. a lot of anxiety and depression.
Wow.
Yes, I agree with that.
Wow. So mental health is a really key concern that you guys are seeing. Anything with physical health that's not being addressed?
Well, I think a lot of like the male presenting lesbians sometimes feel they don't need a pap smear or they don't need to see a doctor. But, we're all women. We're still women. We still need to have those preventative testing done, whether it's mammogram, pap smear, colonoscopy. We need to have all that done yearly.
So I take it you probably agree. Is there anything else that stands out for you?
I do agree. I think especially with the anxiety and depression and the coping mechanisms that people have, especially with drinking and, drugs, they're not very forthcoming with that information, disclosing that they're putting these things in their body, especially with alcohol. I have a lot of friends that have issues with alcohol, and they don't talk about it with their doctors. They're not being honest about how often they're drinking, how much. And I try to be the nicest I can be when saying, when you destroy your liver, that's pretty much, it's kind of like it for you. And so we don't want you to do that.
Right.
But
yeah, when you say the liver, when they come in and we're doing blood work and why are your liver enzymes so high and they haven't admitted to drinking or that they drink very much, we're chasing the cat's tail, trying to figure out why these labs are abnormal, and they just didn't want to admit that they're drinking more than what they're saying because they're depressed or whatever's going on.
Wow, that's when I was when we were gathering questions for this, that didn't even come to mind, and that's why it's key to have conversations where people are sharing this sort of thing, because I didn't even think about some people may be drinking to excess, and some of the root causes that are related to that. So hopefully if somebody out here is listening and has those kinds of challenges, that they'll speak up and be open and honest with their providers to get the help that they need with that as well. Something else that I wanted to kind of touch on as we kind of wind down here is as far as intimate and romantic relational health and sexual health, just in your experience being part of the community, is that something that most Black lesbian women are discussing with their providers? Because I've heard some very interesting things about myths that exist out there about lesbian romantic encounters and physical encounters, and how they don't necessarily, there's less risk involved. If you guys could speak to that briefly, and maybe just give a PSA, because you are in the healthcare field, that that's not the case.
There is less risk, but there is still risk.
Right.
Whether it's a lesbian relationship or a heterosexual relationship. I think when you see the commercials for all the drugs now and the lesbian couples or the gay couples, and it does center more around the males than it does the females, but there's risk on both sides, one a little greater than the other. But like I said, it still boils down to having those regular checkups and being honest.
Absolutely.
Definitely important. And I think within the community too, I've had experiences, especially recently, where I've gone and gotten tested just because I want to make sure that I know my status. And it touches a nerve with people when you're going to make sure that you're okay. And it's like, well, why are you getting tested? What have you been doing?
Mm-hmm.
And it's like, I just want to make sure that
I just want to make sure I'm okay.
I'm not doing anything. And even asking somebody to get tested before any type of intimate encounter can sometimes be like a traumatizing experience, because they make you
get
feel
real defensive.
really bad. Yeah. And so in turn, it's like you just don't even really want to talk about it anymore. So you could be with your partner for 6 years and never get tested because you just don't even
want to bring it up.
Have that. Yeah, you don't want to have that conversation, because it's like people don't want you to be healthy. That's what it feels like sometimes.
Yeah. Do you think that part of it is just the fear of knowing? I feel as though some people would rather be in denial about a thing, or are really not willing to accept the possibility that this is something that could be happening. Like the unknown is better than, oh, I went and got tested and found out for sure that I have some situation.
Absolutely. And then as far as when they're having the test, just the embarrassment or the feeling they're being judged. But it's still important to do.
Absolutely. Definitely so. And would you agree that even if you're in a relationship, every 6 months to a year,
be tested
to have your your panel done? Awesome.
Yes.
Awesome. Thank you, ladies, for sharing that, for sure. So hopefully somebody listening.
Go together. I mean, if you don't want to go by yourself, go with your partner.
Absolutely. Absolutely. Make that a regular part of your time together. Do you ladies have any particular resources that you can just think of off the top of your head that listeners can access to make the conversations with providers easier, or to have like a list of things that you should be having done at certain ages? Hey, I'm 30 now. This is what I need to be having tested, or I'm 40 now. Anything that comes to mind for you?
There's a website it's probably on the CDC for preventative care, where you can see what needs to be done at what age. Like mammograms start at age 40, colonoscopy start at age 50, and go on like that. CDC has everything.
Yeah.
Okay. So the CDC is the major resource
that was my go-to.
Awesome.
Yeah.
Awesome. So we will definitely put that in the show notes, and then share that in all of our posts of the episode as well, so that people can access that resource and find out what they need to be doing to keep themselves healthy, because we only get one body this time around. So
that's right.
If you mess this one up, where are you going to live? Thank you so much for having this conversation. You've been amazing. And I just want to tell you how much I appreciate you for being here, and give each of you a minute or so if you have any closing thoughts or anything you'd like to share with our listeners about their health and wellness from your perspective, by all means.
From my perspective, being a provider, I'd say anyone going in to see a new provider, or who is searching for a provider that is LGBTQ, you have to do your research, like Kearston said earlier. Find someone who you think you'd be comfortable with, and be honest when you go in, without feeling like you're being judged. Sometimes it's the provider's issue, but make sure you're being heard and they're hearing your concerns and your needs.
Awesome.
Yes.
Thank you.
I want to piggyback off of that and remind people that it is well within your rights to get a new provider. If you don't like the one that you have, if you feel like, your doctor is not listening to you, or not explaining things well, you can find a different provider. You don't have to stick with someone that you don't feel comfortable with.
Absolutely.
Awesome. Awesome. Thank you, ladies, again for the incredible information that you've shared with our listeners on this episode, and for the wonderful work that you're doing in the community on a daily basis. Healthcare could not function without amazing nurses like you. So thank you so much for that. And to our listeners, I want to say thank you so much for being here and being a part of this episode. You'll find in the comments below this episode, and on our website, you'll find show notes with resources to assist you with everything that you are doing on your own. If you're listening to this on a podcast app and you cannot see the show notes, you'll be able to see those at Kappa Theta Epsilon.com. That's KAPPATHETA EPSILON.com. In the meantime, take care of yourself and each other. And thanks for listening to the Swan Report. We'll see you again soon. Take care.
Thank you.
Thank you.